Hi, my name is Mark Squires, the Medicare Whisperer. My team and I don't work for Medicare. We're insurance brokers. When you have Medicare questions, we have Medicare answers. Welcome to another edition of the Medicare Minute. Listen, on this week's edition, we are going to talk about VA and Medicare. All right, so you're a veteran. Thank you. Thank you for taking my place. Thank you for your service. But you're a veteran, you're on VA, you're thinking, oh, I don't need Medicare, I've got VA. Well, maybe you do, maybe you don't. There's no such thing as one size fits all. You've heard me say that a million times. So if you are a veteran, number one, you should be checking out your veterans' health care benefits. Find out what you qualify for. And don't give me the line about other guys need it more than me, because the part of the Veterans Administration budget that doesn't get spent on the veterans goes back to Congress as a slush fund. Do you want Congress people to have a slush fund? You're going to hear a lot of misinformation out there about veterans. If you're a veteran, you may or may not sign up for Medicare. Sign up for Part A anyway because you've earned it. Part B you may or may not need. Find out, first of all, your priority group. If you're in priority group 6, 7, or 8, now I don't have time to explain that to you. Call your Veterans Service Officer. If you're in priority group 6, 7, or 8, you really want to consider signing up for Medicare Part B, because if Congress ever cuts the Veterans Administration budget, that's where they're going to start. All right? But if you have Medicare Part A and Part B, you are now free to go to a provider who is outside of the VA system. May give you more freedom and maybe a little bit quicker service time if you need medical care. Now, in the world of Medicare, we have Medicare A and B, that's inpatient and outpatient. We have Medicare Part D. If you're a veteran, you don't need Part D necessarily. We have Medicare supplements, but there's something called the Medicare Advantage Plan, and this is where I want you to pay attention. Steve, how can a veteran who's on Medicare A and B, by the way, this is Steve Ford, the Vice President of Medicare Insurance Sales. How can a veteran who's on Medicare Part A and B benefit from a Medicare Advantage Plan?
Absolutely. A veteran may have a different provider, such as a chiropractor, outside of the VA that they want to go see. There are plans available to those veterans that will give them a lower copay or a discount on those services. There may be a cardiologist you want to see outside of the VA. You will have the ability to have access to those providers while also keeping all of your VA benefits. They're not one size fits all. They're not fit for every veteran in every situation, but it's a really important thing to find out, and you can find that out anytime by calling us at the Medicare Whisperer.
816-399-4871, or check us out on the web at
lifewithmedicare.com.
We're all over the place on social media. By the way, if you go to our lifewithmedicare.com, Steve tells me there is an absolutely huge blog section on there. You might have a question that we've already answered in the blog section. So check us out, 816-399-4871. Reach out to us today. Thanks for watching another edition of the Medicare Minute. We'll see you next week. Bye now.